there anything else you think then we should know about neutering and behaviour?
Yeah, I just want to kind of touch on bitches that have had false pregnancies. So sometimes a bitch will have a false pregnancy and the client will want the bitch spaying. But it's really important with false pregnancies that we don't neuter her when she's actually in a false pregnancy. Now, sometimes that's when there's presence of milk, and I know pre-surgically you'll be checking those dogs over, but sometimes it's behavioural signs that we need to rely on the client to talk to us about in the practice, because it's not just milk in the glands that gives us clues whether or not our dog is still in a false pregnancy. It's her behaviour. It might be that they're a little bit more anxious. It might be that they're a bit more clingy. It might be that they're favouring a toy and maybe not wanting you to get hold of that toy, a little bit more resource guarding over a toy because in their kind of psychologically they think it's a puppy. It may be that they're making a bed more. So it's really important that our clients are able to kind of talk to you about those behavioural changes at home, not just the physical outward changes that you're checking for, because we don't want to spay a bitch when she's in a false pregnancy, because we can be almost locking her in to a false pregnancy behaviourally. So we want to make sure that she's well out of that false pregnancy, and that can be a matter of time. And usually we will say with kind of the spaying time on that, and this is something that you can obviously advise clients about, but usually we want to be at least 3.5, 4 months after the season has ended, and maybe even beyond that. But if we've got a bitch that is kind of in false pregnancy and we're kind of waiting and she doesn't seem to be coming out of it, there are drugs that will help bring them out of false pregnancy, and you'll be able to chat to the client about that.
Absolutely, and we can definitely give medications if needed. As you say, most come out by themselves, don't they? Particularly if we don't allow them to do too much of a nesting behaviour and things that reinforces the signs.
Yeah.
But some do need that medication. Absolutely, we can do that.
Yeah.
We need to be fully out post medication and be confident that's resolved before we go ahead, and that for some dogs does mean looking at delaying things much closer to kind of 5 months potentially, depending on length of season. And
much better to delay and wait to make sure that the bitch is out of a false pregnancy. Absolutely, yeah. I mean, one of the things that can perpetuate milk is if a bitch is licking a lot in her mammary gland area, because obviously licking is inducing milk to keep coming through. So there are some things that can maybe kind of perpetuate the outward signs. However, it's always better to err on the side of caution and make sure that our bitch is fully out hormonally, what we call hormonally neutral, before we spay them. Yeah, definitely.
No, that's really
but yes, I mean, there's quite a few things to think about, and it's always a good idea to spend time chatting to you about, about why you might be wanting to have a dog neutered, what your reasons are, because then you can chat about that and allay some of the kind of misinformation that's out there, and chat about optimal times, behavioural things that we can do behaviourally to help a dog before we book them in. But yeah, there are quite a lot of things involved in the neutering decision, and that's really important that time is taken to kind of get it right.